Good evening and welcome to another edition of What's Happening. I'm Gail Burke. I'm here with my co-host, George Binns, and we have a very interesting show for you tonight. But before we start, I would like to do a top of the page and just say a few words about the election. The election was a week ago tonight, and as you know, Donald Trump is our president-elect. And I would just like to talk to some of the people who are out in the streets protesting. There's such a thing as peaceful protesting, and rioting in the streets is not peaceful protesting. There's a liberal constitutional professor from Harvard by the name of Sanford Levinson. He gave a talk at Harvard on October 21st in which he said he thinks Donald Trump is a sociopath, and it would not be legitimate for the rigged electoral college to elect Trump with only 43% of the vote, and that riots in the street might be warranted to block Trump from taking office. This is an educator at Harvard. I think he's inciting his students. Don't believe that a Harvard law professor is this radical? You can catch him on YouTube. Abraham Lincoln won the presidency with only 39.8% of the vote, of the popular vote. Trump won the electoral college by a very wide margin. So you're protesting in the streets. For what? Why are you destroying people's property and attacking other people? Our election process in this free country worked as it should. So why are you protesting? You didn't get the results you wanted? Welcome to the real world. You're being used by paid political agitators. As president-elect, Donald Trump said in an interview a few days ago, "Stop it." Thank you. George?
Well, this evening, as Gail mentioned, we've got a guest from our continuing expose of what's going on at the YMCA. And our guest tonight is Bret Ferrell, and he is the director of the clinic at the Stirling Center, among other things. Welcome to the show, Bret.
Thank you, George. Thank you, Gail.
Now, what got you into physical therapy from the beginning?
Well, I think like a lot of therapists, it comes down to past experiences when I was young. I played a lot of sports growing up, and between things such as sprained ankles, pulled muscles, I went to some physical therapy of my own when I was younger. I enjoyed the time that I spent with my physical therapist when I was younger, doing exercises, kind of fun little challenges for sprained ankles, and thought that that might be something I'd like to do as I grew up. And actually, I do attribute a lot of it to kind of weeding out some other avenues that I thought I might go into, one of which was engineering. My mother, back when I was in high school, sent me for a week to an engineering camp of sorts, where for a number of days you got to explore different types of engineering. Well, one of those was in some mechanical engineering, where they were trying to develop a chest protector for a baseball catcher. And they were speaking about how the catcher got injured and how if he had a better chest protector, he could have, avoided the rehab and the injury that he sustained. And as I was sitting through, these talks and these things that we were doing, I thought, you know what? I think I'd have more fun rehabbing that injury than trying to develop this chest protector. Mm-hmm. So from that time on, I realized, okay, maybe engineering isn't my thing, but being strong in math and sciences, thought that physical therapy could be what I wanted to do, and that's what led me into the field.
Well, I've also been involved in sports along the way, and I got into the over 35 leagues for the big kids. And when I would get injured, you go to the doctor and he'd say, okay, you got a ruptured disc, or you got a bulging disc, or you got some other problem, and maybe do some of these exercises and we'll see you in 6 weeks or sometime. Nowadays, there seems to be a lot more, I guess it's conservative treatment, but there's a lot more follow-on and a lot more activity. What made the change, do you think?
Well, I think that's multifaceted in the answer you'd have to, give for that. One, obviously, the finances of healthcare. For the conservative care, is a lot less expensive to run through conservative care. But I think more importantly, and for our message as physical therapists, is that through research we're coming to find that utilizing that conservative care in the long run is actually more effective than jumping into something such as surgery, or sometimes even worse yet, just sitting there and ignoring the injury and saying, okay, come back in a month and it'll go away. Then you come to find a month, 2 months later, you get back into your activity and things are actually worse, because now not only do you still have the injury, but now you're weaker for having sat there for 2 months.
Wow. Now, I played a lot of sports when I was in school, too. Basketball and softball, tennis, field hockey. But I was very lucky. I think the worst injury I ever suffered was a sprained ankle, so I didn't have to get into any of that. But I can see today how the sports seem to be a lot more strenuous. Especially like with soccer. Do you see a lot of soccer injuries?
Absolutely.
Because they don't have much protection.
Yeah. So I think all sports have their inherent risks when it comes to injury, and we see a lot of athletes of all ages, as George mentioned. The over the hill gang that gets together and plays soccer on the weekends, or being in the Beverly YMCA, large gymnastics facility in there, swimmers. So with each sport comes different types of injuries, and also with that different ways you need to rehab those injuries as well. So that's where getting into some of the expertise and the knowledge of the rehab, for physical therapists, that's where we come into play.
Do you get a lot of older people that have played, say, especially like football, as they get older, their knees start to give out, or because football's quite a contact sport.
Yeah, contact sports like football, I think you have your immediate trauma of the game, so you have your broken bones, your pulled muscles, but then, kind of you're referring to the aftermath of that, so, 10, 20 years down the line, how are we feeling? I mean, we're not all professional football players, so you don't get paid millions of dollars on Sunday to go and play and say, okay, well, I can afford whatever comes to me later on down the line, but all of those injuries can certainly build up. That blunt force trauma can build up over time, and that can lead to different impairments down the line. The dreaded word arthritis, wear and tear on your joints. The more active and the more trauma you experience in the joint, the more likely you are to experience some of that later on. But once again, there's a lot as physical therapists that we can do for that.
Well, the other thing I think I want to point out, it's not so much the contact sports or football or something. One of the ones that surprised me is the rugby players, who seem to be extremely aggressive, have a lower injury rate than the football players. And there's a little bit of psychology, if you will, of if you aren't padded, you're not going to really take that flying leap into somebody, as opposed to, hey, I'm armored plated and I can do anything. And I think one of the arguments I've heard is that one of the worst things they did is put the masks on the hockey players, because now they can use their head as a part of the game.
Yeah. Well, my son played hockey when he was a kid, and he was short. And as he got a little bit older, 13, 14, he was a goalie. And in those days, the padding was not the way it is today. And he finally came to us one day and he said, you know what? I don't think I want to play hockey anymore. My husband was the coach, and he said, why is that? He said, I want to keep my teeth. And of course, the kids were all a lot bigger and stronger than he was. So that was the end of his hockey career, which we were very thankful for, because,
I think, speaking to a lot of sports, and you speak to the difference in, rugby injuries and then also football injuries, is technique that comes along with any sport as well. And I think, as physical therapists, we tend to rehab their injuries after the fact. But when, as physical therapists, we can work with coaches, work with personal trainers, work with athletic trainers that have a lot of direct contact with these athletes too, we can help to sometimes perfect technique, along with them. One example I would give specifically would be with swimmers. When I was managing a clinic on the South Shore a number of years back, we had a program with the swim club that was in the gym that I practiced out of, where we would get the swim coach together with a personal trainer and then with the physical therapist to analyze what was going on with each swimmer. So the swim coach knew exactly how they wanted that swimmer to perform a stroke. Physical therapists could look at that and be like, okay, well, we're looking at potential for overuse injury due to how the swimmer is now using their own personal interpretation of that stroke, and then bring the personal trainer in to say, okay, we know they're doing this, that, or the other thing. How can we now strengthen them, from a healthy athlete standpoint? So that kind of, grouping, conglomerate of medical and healthcare wellness practitioners, come in to help the athlete, teaching technique, being back to that overuse or that trauma point with that.
You mentioned you were managing a clinic on the South Shore. Was that part of Bay State?
It was, yep, down in the Weymouth.
Okay, how does Bay State work?
So Bay State, we're a corporation. Part of our business model, and I think what is the strength of Bay State as a company, is that each clinic has a managing partner. So I'm a managing partner and then also the clinic director in the Beverly facility, along with the Salem facility that we have on Highland Avenue in Salem. And so each clinic is run by a physical therapist. We don't have an entrepreneur coming in to run a clinic that's in there to just purely financially benefit from operating a facility of ours. We have someone who is a physical therapist, continues to practice physical therapy, and then brings their business acumen into it as well in order to make it a successful clinic. And so down there on the South Shore, I was a clinical manager for one of the partners down there. And then one of the nice aspects of Bay State is, the president and CEO at the time, they saw some of their younger therapists who were striving to do more within the company, bringing therapists along like myself, and then I became a partner, and that's when I opened up the Beverly facility.
Yeah. Is it kind of like a franchise type of operation?
Similar, yes. So as a partner, I have a financial stake, within my individual clinic in Beverly, in there. So each clinic is run independently from that standpoint, from a financial standpoint, but we're part of the corporation of Bay State Physical Therapy, which gives us a lot of advantages from having our own central billing department to where you don't have to outsource that, and we have some control and some say over how that goes for us. So it makes us more efficient and more effective from that billing aspect of physical therapy.
So Bay State as a corporation runs the overhead part of the game, the billing and advertising and purchasing and all that, whatever.
Yeah, so as a partner from the purchasing standpoint for each individual clinic, the partner would manage that aspect. But as partners, like I said, we meet on a regular basis and then have say kind of how the corporate office manages things. So it's nice from my standpoint. I have the comfort of knowing that I have a larger entity in Bay State to help me from a marketing standpoint, and just from the footprint that we provide throughout Eastern Massachusetts. We are the largest provider of outpatient physical therapy in Eastern Massachusetts. So we have a large footprint. Let's say I have a patient, and case in point, I had a patient in Salem this past summer. She was seeing me for some concussion symptoms as well as some neck pain. And she was moving down to the South Shore. We have a clinic right in the town where she was moving to, so I was able to contact the partner within that clinic. Smooth transition the next day right into that clinic. All of our notes and everything transfer over so she could go down there and do that. So that's one nice aspect of being part of a larger entity such as Bay State.
Now you're located inside of the Y. Are your other facilities located at the YMCA's in the different communities? Because you have access to all that exercise equipment and all that, which is great.
Yeah, so we actually have 7 of our clinics are located inside YMCA's. Okay. About 2/3 of them are located within gyms themselves.
Oh, okay.
And others are freestanding. So I'm also the partner in our Salem facility, which is a freestanding clinic. We're on Highland Ave, right in front of the high school, 2 blocks down from the hospital. And part of the success of each clinic of Bay State Physical Therapy is in the location, I think, that we've set up in our interaction with the community. So each clinic, and part of what's nice about having a partner that works in, treats in, and manages that clinic, is that we get to know the community. And based on our physical setting, we're able to then integrate ourselves into that. And the YMCA, as you mentioned, is great having the gym facility right there that we can utilize. Our close interactions with the personal trainers that are in there, with the swim team, with the gymnastics team. Those are all things that we've really kind of intertwined ourselves in and tried and become part of that wellness model that is the YMCA.
One of the things that I think is very important too is that you accept all kinds of health insurance.
Correct. Yep. We
Medicare,
accept all.
Medicaid, and the whole gamut.
Yep. All major health insurances we accept. Obviously, in today's day and age, every insurance has many plans within that insurance. But I personally, as a clinic director, I don't want patients to question, oh, can I go and see my physical therapist because of my insurance? So what I'd rather have any patient or anyone that has an injury that's questioning if they can or need care is just come and ask us. But we have great front desk staff that is able to access the insurance company and find out exactly what your benefit would be as far as that's concerned. But yes, we do take most major health insurances from that standpoint, both federal and private insurers.
Well, you also have quite a comprehensive web page, which I found very interesting because it tells the whole story of your operation.
Yep. It shows all 39 of our clinics on there, and then it shows the clinicians that are in each clinic as well as the specialties that clinic focuses on as well. So yeah, you can find out a lot of our locations and specialties from there.
That's good.
Well, you started to mention that you have a front desk and thing. One of the things that surprised me, I guess, when you first started up, you put a little sign out in front that said, hey, if you got an injury, come and see us. And I've taken advantage of it several times, and I've talked to you before about, the magic hands have made that go away. How does that work? If you, for instance, find somebody's got more problems than what I've had, what happens next?
As far as a screening would be concerned, or a free screening. So yeah, that's something that all of our clinics offer are free screenings. And as I said before, I want anyone that has any injury concerns, just come in and talk to us. And it's real easy in the Beverly YMCA. You're right in the gym floor, you're doing your workout, you're doing your bench press, and all of a sudden you feel, I feel like I pulled something in my arm or in my chest. It's just as easy as walking in, speaking with Lume, who's at our front desk, and saying, I think I injured myself, could I speak with one of the therapists? And then she'll come and find one of us, and if we can't do it right then and there, we'll set up a time that's convenient for you to come in and have a free injury screening with that. And that's at no charge to you, to your insurance company, to anyone. It's just us being able to sit down with you and say, okay, this is something I think physical therapy might be necessary for, or you know what, maybe you should see your doctor about this because it sounds like something that they might need to run some testing on, or you know what, put some ice on it, throw some heat on it, give it 24 hours, I think you'll be good to go and you don't need any further care. But it's more so offering gym members peace of mind as to, what avenue they should take in order to feel better and continue to exercise.
Well, that was one of the points that Rihanna made when we had a discussion with her a couple of weeks ago, that the Beverly Y in particular, it's not just like a gym where you go, you pay your $10 a month and you get access to the facility, but they're looking for creating an experience. And one of the experiences, like you said, is, hey, a peace of mind that, hey, if something goes wrong, or I get a little concerned about, what was that little twitch all about? You can get some help and guidance on it. How integrated are you with the Beverly Y?
Very much so. I've mentioned the different departments that they have there, but especially where our facility is right off the gym floor. So you can literally walk 5 steps off your treadmill and be in our clinic. We do a lot with the personal trainers in there. So we work with the director of the trainers in there to make it an easy transition, not only from personal training where you might have an injury to come in and see us, but then also in the reverse, in that when you're in physical therapy and okay, you've graduated, maybe the injury is gone, you're feeling all better, or in some scenarios, okay, maybe your health insurance has run out and you can't have care anymore, but we know you still need that strengthening. Then that's when we speak with the personal trainers out there and promote and facilitate that transition to personal training out on the gym floor. And we've started a program that she might have mentioned to you.
Yes,
Actually, we started a few years back. It's a 60-60 program where the Y will give you a discounted membership for 30 to 60 days to come in and continue to use the Y. So it might be someone who's come to us, because you don't have to be a member of the Y to come to the Beverly facility or any of our facilities. You might not be a member of the Y, but in coming to us for 4 to 6 weeks on average, you've gotten to know some of the equipment and might be thinking to yourself, all right, you know what, this makes sense for me to continue doing this strengthening. So we wanted to make it an easy transition into work with a personal trainer, and that's what the Y has helped to facilitate through that discounted rate to get you started.
What are these? I'm sorry, go ahead.
No. I am also a graduate of yours, as you know.
They're all around.
But my problem is that I should go back and do some of the physical training, and I'm not doing it. I go downstairs to the water aerobics. I do that. And I keep looking upstairs, and every once in a while I catch George, and he gives me the wave. And I think, yeah, I got to do that too. And I get lazy about it, and I don't want to do it.
Yeah.
I know I should.
But the aquatic therapy or the water aerobics,
Yeah.
stuff that you're doing in the water is also a very important aspect of a lot of exercise programs, and we do offer aquatic therapy in the YMCA as well. So things such as back pain, maybe post-surgical or just back pain in general, or even post-knee surgery, being in the water, having the buoyancy of the water, unloading joints, it can be a very good thing for you. But
does help,
yes,
yeah.
to your point, being on the gym, doing some of that strengthening is
I
good as
need
well.
that, yeah.
Some people love to live their lives in the water, but we tell them eventually you have to get out. So,
Well, do you have therapists actually go down and do things in the water with them?
Yep. We have 2 therapists that are actually in the pool with you when you're doing
Okay, yeah.
your aquatic
really?
therapy.
I
Yep.
didn't know that, yeah.
So they can not only guide you through different exercises, do certain hands-on things in the water, but yeah, for us it's very important that the therapist is in the water with them. Some places they might bark out instructions from the shore, as we call it, but yeah, for us it's important that the therapist get in there and be hands-on, be one-on-one with that patient, with that client of ours, because it's that personalized attention that I think makes physical therapy what it is. It's not coming to the doctor and talking for 5 minutes and then being handed a script for medication. You're with us for half an hour to an hour for each session, and it's our hands-on skills and expertise is where we can really benefit in that education that we have to offer over the time that we spend with you.
Well, one of the things that surprised me, I went through a hip replacement exercise recently, and as part of that, one of the doctors suggested conservative treatment. Go see a physical therapist, which is why I came to see you, and they also said go see a chiropractor. So what's the similarities, what's the difference between those two? And I was surprised when he said go see a chiropractor, because I thought that was totally out of the medical profession. They don't talk to them at all.
Yeah, so our skill sets really do overlap quite a bit when it comes to physical therapy and chiropractics. It's actually interesting, the president of our company is both a physical therapist and a chiropractor, so he comes from a background in both. My first job down in Weymouth on the South Shore that I mentioned before, in that clinic we have a chiropractic office directly in with our physical therapy office as well. A sister company of ours that our president also owns is Milton Chiropractic. So we do integrate ourselves a lot, and I think for the right diagnosis, for the right individual, that combination of treatment can be very effective. As I said, our skill sets do overlap quite a bit. As physical therapists, we do a lot of manual work on patients. We do what we term mobilizations or joint manipulations. So the kind of classic thought on it is snap, crackle, pop that you might get when you go to a chiropractor. We would term that a manipulation. But it's us working to regain mobility at a certain joint level. Chiropractors also do that. They call it an adjustment that they work on. So that working of the joint, and sometimes there's some subtle different philosophies behind why physical therapy and chiropractics might do it, but in general we're looking to promote movement within the joint. And then as physical therapists, it's very important for us to then take it to the next level as well, and making sure that we're strengthening. So we're gaining joint movement and then promoting strength around that joint so you can control that movement, perform your daily activities, recreational sports, all of that.
Now, what's your feeling about acupuncture?
Personally, coming from a very wellness-minded background, being located within Y facilities, gym facilities throughout my career, my feeling is that anything that can help promote pain relief, circulation, improved movement is beneficial to my patients, to my clients. So I always recommend, if it's, if the patient has the means to go and experience acupuncture, I recommend them giving it a try. I can honestly say I have probably 5 to 10 patients that are currently having acupuncture done in conjunction with physical therapy.
Yeah, I've had acupuncture, and it's very interesting. It does work, but it's like anything. You have to keep going back and maintaining. Right now, I have a friend who's a massage therapist, and I go to her maybe once a month just to keep things moving, because I know if I don't go for 5 or 6 weeks, I can feel it.
Yeah.
And she knows, because I come to her and she said, "Oh, your muscles are so tight." And I say, "Well, I haven't been doing as much exercise as I should." And as you get older, I know that I should, and it's, you get a little bit of arthritis, and it's a bad day, and you say, "Oh, I don't think I really want to go out today." And you have to push yourself.
Yeah.
I think when I was younger, well, I had 3 children, and I was running around all the time. I never gave it a second thought, because you're always moving. But as you get older,
Yeah, no, and
you
it's
really need
interesting.
it.
You keep mentioning, the word, moving, the term moving. Our national, the American Physical Therapy Association, our tagline is "Move Forward." So we're trying to constantly be promoting movement, motion within the human body. George and I were talking earlier about, how he's making it to the gym 6 days a week. Some days you have to really kick yourself in the butt to get going.
I admire him for doing it.
Yeah.
I can't do it.
But to get yourself up and moving during the day, I think almost anyone can say that they feel better when they get out of bed and they get moving.
do.
And our job as physical therapists is to make sure that you can continue to move, that you have the strength, you have the pain-free daily activities to continue to move.
Well, since you brought up the idea of a massage therapist, where does that fit into this spectrum of doctor, physical therapist, chiropractor, massage therapist, acupuncture? How does that work?
So a massage therapist would fit into that wellness model that we try and create. But massage as a technique is also part of what we do as physical therapy. Part of any treatment that you would, or most treatments that you would have in physical therapy, would include some sort of massage, deep tissue work in order to help mobilize that
That's
tissue.
the thing you used on me, the roller with all the lumpy things on it?
That's one technique
Yeah.
that we use. Yeah, exactly.
Okay.
Different deep pressure type techniques that we would have, using those techniques to keep the muscles moving once again.
Well, I know that my massage therapist uses hot stones, and she puts them on my back, and it really feels good. And she'll say to me, "Do you want me to take them off?" "No, leave them on."
And once again, that's promoting blood flow, and blood flow is good for the body, and when it's good for the body, that's everything, all the pieces of the puzzle that we have to put together. Human body is a very intricate system. It's a working, mechanical. Piece that we need to make sure that we're continuing to keep healthy, and that's where physical therapy we can play a major role in that.
You talk about the different techniques. There used to be a show on TV. It was rated for doctors to get their qualification for annual experience. And it was Dr. Sledge that used to run it, and he had a young doctor on there. Were talking about back injuries, and he said, "Okay, how do you determine the significance of a back pain or injury?" And then the doctor was saying, "I got 2 tests, and one of them is, do they use heat or do they use ice?" And the theory being that ice is more effective, and if you're using ice, you've really got a problem and you're working on it. If you're using heat, it's okay. And the other test he used was he holds the patient, gets the patient on a table with feet over the end, holding his hands behind the heels. And so you get one leg at a time, you bring it up. And he's feeling the other leg. Because to get one leg up, you got to push down hard on this one. If you're not pushing down hard,
You got a problem.
you don't have as much of a problem as you think you have. And then the next question was, well, where do you treat these patients? He said, "I'm an Army doctor, and I'm looking for gold bricks." And with that, we're running out of time, Bret, and we'd say we appreciate you coming by.
Thanks for having me. Appreciate it.
It was fun.
Yeah.
And
Very
ladies and
informative.
gentlemen, Stay tuned. We'll be back with some more stories about what's going on in town.